Hello, everyone in the virtual world. It's the Macomb Family Services Prevention Team in Romeo, Michigan. We serve the northern Macomb area. Um, some things that we like to focus on is substance use and abuse. And today we are going to be presenting a presentation that we have crafted as a prevention team. And the presentation will have to do with different drugs, penalties of abuse, scheduling of drugs, different maybe classifications and effects that they would have on people, and then some negative side effects of those drugs. So we want to get started. I'll introduce myself. My name is Mr. Cody. I am a certified prevention specialist on the and I also serve on the Northern Macomb Prevention Coalition, and I work at Macomb Family Services. So, Miss Ashley?
Hi guys, I'm Ashley Gutowski. I'm a prevention specialist at Macomb Family Services, and I am also a outpatient therapist. I work with both mental health and substance misuse clients, so a lot of this information is right in my wheelhouse. Leah?
Hey guys, Miss Leah. I'm a prevention specialist with Macomb Family Services. Mr. Joe.
Hi everybody, Joe Thayer with Macomb Family Services. I'm a certified prevention consultant and also the director of prevention here at Macomb Family Services. Hope everyone's doing well given our current situations. And again, yes, as Mr. Cody talked or mentioned, we're going to be talking about drugs of abuse today. So here we go.
So the Controlled Substance Act places all substances which were in some manner regulated under existing federal law into one of 5 schedules. So the scheduling is based upon accepted medical use, potential for abuse, and safety or dependence liability. So basically what this is doing is it's scheduling different controlled substances that exist in the country, and those controlled substances are scheduled based off of how quickly people might be addicted. Are they used as a medicine, and can they be considered safe for an individual to consume or maybe manufacture? So proceedings to add, delete, or change the schedule of a drug or other substance may be determined by the DEA. So there's different things that would do that, and that's the drug's actual or relative potential for abuse, some different evidence of the drug's pharmacological effect, if known. So some other things too that kind of refer to what I was talking about before, where is it used as a medicine? They kind of just analyze the drug and say, is this something that people need to freely have? How should we regulate it? And if people are using it illegally, how should we enforce laws basically to stop people from using it illegally? So the first one is Schedule 1, which is the highest scheduled it's the highest schedule of drugs and substances. So some examples of things that would be a Schedule 1 drug would be heroin. Also marijuana is included there along with LSD, some different things, which are hallucinogens.
And for something to be a Schedule 1 drug, that means it has no medicinal purpose, or we haven't classified it as used for medicinal purposes, and it has a high likelihood of someone becoming addicted to the substance.
True, thank you.
As you can see on that previous slide as well too, marijuana is listed on there as well too. Currently it's listed as a schedule.
Yeah, so even though in the state of Michigan we have legalized adult recreational use, it is still a federally illegal substance.
True. Thank you for adding that. So the next schedule would be Schedule 2, and that would be something that does have a high potential for abuse, but not as much as Schedule 1, and it has an accepted medical use and treatment in the United States. So these are things that people could use medicinally or as a actual medicine, to where marijuana isn't necessarily classified as a medicine. It's just something that people could use in medicinal form or get permission from a doctor if they live in a medical marijuana state. However, different substances that are scheduled to include morphine, also cocaine, methadone, hydrocodone, and you see fentanyl there, which I put a picture of fentanyl next to a penny. So although fentanyl is something that is prescribed in certain cases, particularly with like cancer patients, people who are in serious pain, you can see there that amount of fentanyl, the little dust, the white dust next to the penny, is what can actually kill a person. So it's a fatal dose is what we would refer to that as. Also on the Schedule 2, I'm sorry to go back to that. Thank you, Ms. Ashley. You see there's a good amount of opiates on there as well, which is what fentanyl is. So although opiates can be used in a medical form where people would use them in treatment and actually be helped from them, they can still be abused and are classified as Schedule 2. So thank you. So some things that are Schedule 3 would be like anabolic steroids, particularly because they're not necessarily addictive. Obviously, the body shape and whatever the effects of the steroids, I guess the advantages of steroids would be addicting, but the actual substance itself is not psychologically or physically addicting. But then also things like aspirin, and some barbiturates as well. These have a widely accepted medical use as well in the United States, and typically do not lead to a high dependency or addiction. So the last one, or I believe Schedule 4, not the last one, sorry. So this one is a lower potential for abuse, and currently has a widely accepted use. Is widely accepted for use and treatment in the United States, and very limited physical dependence or psychological dependence. Schedule 5 has a very low potential for abuse, and this includes a lot of cough medicines and things of that nature. Penalties. So the Act provides penalties for unlawful manufacturing and distributing of dispensing of these controlled substances. So basically people who might use or sell them on the black market would be penalized due to their actions based off scheduling. So here might be some penalties that would be assessed if somebody were to use these certain substances. So as you see, cocaine, I'm not necessarily hip on what is a lot of cocaine and what is not a lot of cocaine. But you see, based off of different substance or different schedulings, there's different penalties. And also based off different quantities, there's different penalties as well too. Here's some more penalties continued. Awesome. So as far as chemical control goes, the Drug Enforcement Administration employs a multi-phase approach to combat drug trafficking, which includes enforcement, interdiction, and education. A lesser-known approach, which combines elements from all of these facets, is chemical control. Large quantities of chemicals are required to synthesize, extract, and purify most illicit drugs. The DEA has long recognized the need to monitor these chemicals as part of its overall drug control strategy. So this is kind of what separates a pharmaceutical drug from a street drug as well too. Typically, pharmaceutical drugs are regulated by the DEA, and certain things are put in them that are safer for humans. Whereas if somebody is making something on the street, it's typically done in a lab that's not regulated by the DEA, obviously, and is not necessarily using things that is good for humans to ingest. And that can also lead to a lot of issues as well too. Also, a lot of those substances may explode during the production of the substance, so that can lead to issues as well. So different drugs are classified based off of their properties that distinguish them. So one classification would be narcotics. Next would be depressants. Uh, some things like stimulants, hallucinogens, and anabolic steroids. And that's something that we are going to begin to talk about is these different classes. So.
Yeah, and drugs from each class may be found in different schedules. So a narcotic might be a Schedule 1, a Schedule 2. So even though they're all within the same class, they aren't necessarily scheduled the same. So you'll see, we'll talk about some different, like narcotics specifically is where we see a lot of like synthetics and man-made ones, and also more natural forms where you see them in different classes.
And just to
Or schedules, sorry.
Just to point out as well too, we talked about in the beginning Schedule 1 drug, and one of them was marijuana. I do want to point out that there are 2 Food and Drug Administration approved drugs that contain actually THC, which is the active ingredient that gets people high from marijuana. And those 2 drugs, the one name is dronabinol. It's DRONABINOL. And the other one is nabilone, which is NABILON. Contain THC. They are approved by the FDA, and they treat nausea caused by chemotherapy, and they also increase appetites in patients with extreme weight loss, oftentimes caused by AIDS. So the autoimmune deficiency syndrome. So there are a couple of drugs out there that are FDA approved in the United States that actually do have THC in them. So even though it is scheduled as a Class 1 or Schedule 1 drug, there are some things out there that the FDA has seen that they're okay for use in the United States. There also are some other drugs that are in other countries that are used that have THC, as well as what they call cannabinoids, which is actually something that's natural, found in the body as well too, but it's found in marijuana as well too. So just something to add there. Ashley, you might have something to add in regards to cannabinoids, I'm not sure.
We do talk about it later in the slide show.
Sure.
So cool.
And even though marijuana is classified as a hallucinogen, for the purpose of this PowerPoint, the DEA put marijuana in their own separate category. So just so you know.
So you're going to continue? Good to go?
Yeah.
All right, here we go. So next slide is talking about drug abuse and kind of explaining that for the audience. And it says all controlled substances have abuse potential or are immediate precursors to substances with abuse potential. So that means that if somebody is using, maybe let's say smoking, they're smoking cigarettes, that definitely has an abuse potential because we know that nicotine is extremely addicting. But also it opens up a door for them to try other things and become addicted to different substances that might have more damaging effects as well. So with the exception of anabolic steroids, as we mentioned earlier, controlled substances are abused to alter mood, thought, and feeling through their actions on the central nervous system, i.e. the brain and the spinal cord. So some of these drugs alleviate pain, anxiety, or depression. Some induce sleep, and others energize. Though some controlled substances are therapeutically useful, the feel-good effects of these drugs contribute to their abuse. And one thing that we learn is the more euphoria that a brain feels naturally will lead to a higher chance that somebody will become abused. So different people have different genetics that cause them to react differently to different substances. And typically, if their genetics really appreciate the euphoria that they do feel, it can lead to a higher chance of abuse. And a lot of the effects on the brain and spinal cord are very long-term, especially if the drug use continues. It's not necessarily something that they can reverse. However, if they do quit, there is a good chance that their brain can recover. But a lot of the times when people do take things like LSD, I know that that is something that can stick with them for a long time. And also, even using things like marijuana at a young age, we've seen can stunt brain development as well. Things like alcohol as well too. So.
Yeah, and just to add as well too, Mr. Cody talked about euphoria, and we can change our brain in the way that we're feeling by doing certain things. It could be something like reading, and you can change your brain to feel in a different way. It could be listening to music. Music could soothe you. It could pump you up. For some people, it can cause euphoria without any other drug at all. Another example would be that we use in the classroom is if you like to ride roller coasters. You're not taking any substance, but you're riding the roller coaster and you feel a certain way. You feel euphoria. You feel really good about it. Oftentimes when we talk about this in the classroom, what's the first thing that you want to do when you're done riding the roller coaster? For a lot of people, it's to run back and try to get in front of the line and ride it again. Another euphoria that you might feel, it could be something like you got all A's on your tests, or for a semester, or for an entire year of school, or 4 years of school. Your grade point average is above a 4.0. And so you might feel euphoria in regards to that. Painting could cause someone to be euphoric, again, without any substances used. I know Miss Ashley does yoga and some meditation, or a lot of meditation. She enjoys that. So again, that's ways of feeling euphoria. I would say another one recently, I hope Miss Leah doesn't mind me mentioning this, but she recently got engaged. So I'm pretty confident that she felt some serious euphoria at that moment.
Definitely.
Yeah, you might jump in if you'd like.
Yeah, it was definitely just an experience that I've never felt before, and I think that's always fun to have new experiences because you always feel that euphoria.
Absolutely. And I don't know, Ashley, if you want to, Miss Ashley, if you want to mention anything about, meditation or anything else that you are very fond of, I know as well too.
Well, I would say with meditation, it's less of a euphoria experience and more of a mindful experience of, feeling more in control of your environment or yourself and things like that. And having a better understanding of your thoughts and where they're at, and not necessarily controlling your thoughts, but just acknowledging them and letting them pass. It's a calming, I would say it's a very calming sensation. So normally you might feel a little energetic afterwards because of like that extreme calm. So when you come out of it, you kind of feel really relaxed and ready to go. So some people do experience some sensation of like high energy after they've finished meditating, especially if they do it in the morning.
And I know Mr. Cody as well too, he enjoys playing the guitar, and I know that at several different points since I've known him, he likes to run as well too. So as Miss Ashley's talking, have that calming feeling with your brain as well too. So you can change your mindset. With Mr. Cody, again, you can have that euphoria of playing the guitar or running. A lot of people really enjoy running, and it's euphoric. It's an experience for them. So I don't know if Mr. Cody might want to mention something as well too.
Yeah, definitely the cardiovascular aspect of it, getting your heart pumping. Pushing yourself, realizing what you're capable of is a euphoric thing. And playing the guitar is, they got brands named Euphoria, so it's what it's all about. It's unlocking different parts of your brain, bringing them all together. And I've fallen asleep playing guitar, so it puts me in a really peaceful, happy place. And I know a lot of people struggle with sleeping, and they will use certain substances to kind of counteract that, and it's just one thing I found that's helped me sleep at night. So
yeah, and if you look on the screen there, the things that we just kind of mentioned, each one of us, like for myself, I really enjoy reading. I like taking walks as well too. I don't run anymore, but I like to take walks. And those things are natural to the body, what we just talked about. And so where it says alleviate pain, anxiety, depression, all the things that we talked about, there's no drug involved other than the chemicals that are already inside of our brain.
Mm-hmm.
It could be serotonin, dopamine, a number of different things that are helping us out. And you don't necessarily have to take a substance in order to help yourself out in regards to that. And that's not to say that there aren't medications out there that are necessary for people. We certainly are not saying that.
Definitely. So, basically, this is defining what drug abuse is, and it's kind of when it's used in an inconsistent way and not without legit medical use. So somebody might be prescribed a medication, and if they were to take it in a illegitimate way, that would be considered drug abuse, even if they were prescribed it. So.
Yeah, so a lot of the times what we tell the kids is like, if your doctor writes you a medication and it says take this once a day, and you're taking it 3, 4, 5 times a day, or you're supposed to only take 1 or 2 pills a day and you're taking double, triple that amount, that's misuse of your medication. That's considered drug abuse. Yeah. So even though your doctor said it's okay for you to take it, if you're not taking it how they told you to take it for your body, it's considered abuse.
A lot of times when we talk to young people too, we just tell them also, your parents should regulate that, if even with like vitamins, sometimes we'll talk to people as young as, first grade at summer camps, and we'll have to explain to them, you can't eat a whole handful of vitamins because obviously there'll be some issues. So you got to make sure so we teach them at a young age. You got to make sure, you trust your parents, trust your doctor and what they're doing. So this kind of lays out the different types of dependencies. And I know that Miss Ashley, as a therapist, is very well versed at this, but I also have a good understanding of it as well too. It kind of is referring to what Mr. Joe was talking about with people's bodies naturally feeling a euphoria. What ends up happening when people start to use certain substances is their body relies on that substance to feel euphoria, and their body doesn't naturally make it correctly anymore. So a physical dependence would refer to a change that occurred in the body. So a lot of the times if somebody is having withdrawals from opiates and alcohol, there can be some very devastating withdrawal symptoms if they are physically dependent on that substance. So if they stop drinking alcohol, they might actually have a seizure, which can be fatal, unfortunately. And also if somebody is withdrawing from opiates, which would be heroin and fentanyl, like I mentioned earlier, and even Vicodin, they could have a serious, it's almost like having a flu. They call it being dope sick. And essentially what happens is they are throwing up and shaking and sweating, but it's times 10, I guess, if you would have had the real flu, and it's just extremely agonizing. The psychological dependence is more of a craving or a mindset, a need, the feel for euphoria, the brain chemicals triggering, saying certain things based off what they need. And even drugs like marijuana, other substances as well, have psychological dependencies to where somebody doesn't necessarily feel a physical ailment after quitting, but they might feel a craving. And depending on how strong that craving is, it depends on if somebody will pursue that substance any longer. So. Yeah,
so I'm just going to jump in real quick.
Yeah, go ahead.
So with kind of like differentiating between the two, it seems pretty obvious. With physical dependence, it can be as minor as, maybe you have foggy head after, like if you don't take it for a couple of days. So like you don't necessarily feel sick, but you kind of like can't really focus on things, and you feel like you just are walking in clouds, like you just can't see things clearly, you can't concentrate. So it could be to that degree of you just like, or it can be like shakiness, or, believe it or not, a hangover is considered a withdrawal symptom of alcohol. So, if you've ever had a hangover, it's considered a withdrawal symptom. And so it can be things as minor as that with the physicality of it, like the vomiting, the diarrhea. It can be things like seizures and convulsions and hallucinations and things like that. Those would be really severe ones, but it can be things as minor as like a light shaking of the hand, or like I said, like foggy head. And then with psychological, we keep on going back with cannabis because it's a pretty hot topic in the state of Michigan with the legalization and everything. A lot of the times what we see with cannabis or marijuana is that we see more psychological dependence as opposed to physical dependence. And people won't realize it when you ask things like, how's your mood when you haven't smoked in a day? Or, you know, what's your appetite like? And that's where we start to see that psychological dependence of, I get really crabby, I can't fall asleep without it, or it's, I use it to sleep. And it's like, no, it's when you don't have it, that's why you can't sleep, is because you're having that psychological withdrawal from the substance. So you probably were sleeping okay before it. Maybe it started to help initially, but now you can't sleep without it because you start to have that psychological withdrawal. But yeah, so you'll see things like lack of appetite, change in mood. So it's like, oh, I'm so crabby, I can't deal with people if I don't have it. So that would be more of like a psychological dependence on the substance, as opposed to like, if I don't have it, I feel physically ill. So that's kind of like where we differentiate between like, does your body hurt, or is it maybe something that you just feel really crabby and like, are you hangry? Like that's what I would like kind of equate it with, is like, you know, if you've ever been really hangry and like you like lash out at people when you're hungry, that's kind of like a psychological symptom.
And I do that as well.
Oh, I'm a big hangry person.
Yeah, I catch myself doing it. It's like, gotta be nice. I know you're just hungry. So next, what drug abuse can move on to would be referred to as addiction. Another thing that we refer to it as is substance use disorder, or substance use co-occurring disorder. So, and that is a behavior where somebody is looking to acquire a drug even though they are experiencing issues in their life. So some things might be lost, they might lose things that they value, and it's still hard for them to stop using the substance, which really shows how the substance interacts with the brain. And it's not necessarily them making the decisions anymore, it's more of the substance making decisions. And then a lot of the times legal systems end up making decisions for people. So one thing that we like to refer to or talk to people about when it comes to addiction is, especially in prevention, as we are looking to prevent substance use disorder or addiction, we would say things like, think about your values and the importance of them that they are to you, why you want to have them in your life, how are you as an individual, and then we kind of point out people that use certain substances end up kind of just looking to acquire that substance, and a lot of the things they do are similar, and unfortunately they aren't able to really move on with their life and do exactly what they want to do. So that's kind of where we leave off at addiction. We're talking to people, and a lot of the times addiction occurs based off of, or substance use disorders, we'd also refer to it as, occurs based off of different biological settings. So if people have a natural happy response to the substance, and then different choices that they make in their life. So sometimes people could have a long line of alcoholism in their family, to where a lot of their grandparents maybe used alcohol, but if they decided never to use alcohol or abuse alcohol in their life, then alcoholism is not something that would set in within their life. So anything to add, Miss Ashley?
Nope, just you hit the nail on the head. Compulsive, it's, you know, it says defined as a compulsive. When we talk about compulsive behaviors, it's something you do without thinking. It's not something that you actively are trying to do. A compulsion is something that is like almost like a reaction in a way, but it is something that's almost demanding in your brain. And you know, typically a lot of this does revolve around so when you're diagnosed as having a substance use disorder or having addiction, we use a book called the DSM, the Diagnostic Statistics Manual, which is something that like psychologists, therapists, we all use to diagnose clients. And in that, it's got all these things that you have to meet the criteria for to diagnose someone as having an addiction or something like that, a substance misuse disorder. And it's what's listed on here, you know, if it's interfering with your personal life, your work life, your school, things like that, if it's having a negative impact on those things in your life and you're still choosing to do it, it's considered a misuse disorder at that point. And I interchangeably use use disorder and a misuse disorder. It's kind of just based off of, some people prefer to use the term misuse, some people prefer to use use. And you'll see we kind of use different terms throughout this. Like I say cannabis a lot as opposed to marijuana. So they're all kind of the same. It's just depending on what your preferred language use is.
Right. Well, I say substance use because then it's SUDS, and that's the abbreviation. If we throw an M in there, then it's
I know I messed you up. It's SMUDS.
SMUDS. Yeah, I don't know. It's hard to pronounce.
Well,
Anyways.
misuse is one word, so technically it could just be SMD. But anyways.
Yep.
Distractions.
Yes.
All right. So would somebody else like to continue with the different types of substances? I mean, I don't mind doing it, but I want to give everyone a good chance to speak on the subject. Up to you guys.
I can talk if you want me to.
Okay, yeah, we'll all chime in and everything, but
Okay.
if you want to go ahead.
All right, so we're talking about narcotics now. So narcotics are also known as opiates. The term narcotic comes from the Greek word for stupor. I think that's how you say it.
Yeah.
And originally referred to a variety of substances that dulled the senses and relieved pain. So some of the examples of different narcotics include heroin, pharmaceutical drugs like Oxycontin, Vicodin, codeine, morphine, methadone, and fentanyl. So how are they abused? They can be swallowed, smoked, sniffed, or injected. So on the left, that would be an Oxycontin pill, and on the right, that is what heroin would look like.
So as you see here, as you see here, one is a medically used substance, something that would be prescribed by the doctor, whereas the other one is something that would be bought on the street, and they do the same thing to people. So typically what will happen is if somebody were to abuse their prescription or maybe not use a prescription how they were supposed to, different things, they may end up developing a dependency to that prescription, which would eventually end, the prescription would eventually end, and then they could end up having to buy heroin and things like that in order to still obtain, to not face withdrawals. So thank you.
And physical dependence is something that can happen even if the drug is used properly. So that's something that's not just a symptom of addiction. Physical dependence happens with opioid use over a continued amount of time, which is why we've seen a change in the climate of doctors prescribing only 3 days worth of pills or things like that, because we've learned that there's kind of this magic number of days. It's like 3 to 5 days that after that amount of use, you start to see physical dependence. So even if it's just, you had a surgery or you have chronic pain, you might not be abusing that medication, but your brain still has this physical dependence on the substance. So it can still happen even if the person isn't abusing the substance. They might be using it as prescribed. It's just your brain. We have opioid receptors in our brain, and they fit really nicely in there. And when they're not there anymore, it doesn't feel good. So that's where we start to see the physical dependence.
Yeah, it's not always due to somebody looking to abuse the drug. It can just react naturally that way. I understand.
We would also point out in regards to drugs of any kind, if you're under the age of 25, any kind of a substance is going to affect your brain in a much more dramatic and potentially different way than it would be for somebody that is over the age of 25. And that's just because the age that we're looking at scientifically, they're saying around 25 is when your brain is fully. It doesn't mean you stop learning. It just means your brain is fully developed. So up until around the age of 25, if substances are introduced to the brain, they're going to act differently than if the person was older and their brain was fully developed. But as Ms. Ashley pointed out, and Mr. Cody and Ms. Leah, we're not talking about drugs that are prescribed by a physician because they believe, along with yourself and your family members, that there's more of an asset for you to use those than there is for the risks. So the benefit is much greater than the risks are. Of course, there's always going to be some side effects, whether it's an antidepressant or if it's, it could be chemotherapy, a lot of different things. They're going to have side effects to those. But if it is, as Ms. Ashley described, if it's used the way that it is supposed to be used, whether it's an antidepressant, ADD, ADHD medication, there's going to be some side effects, and also your body is going to get used to it, and you wouldn't want to just cut it off and stop. You would have to go through a plateau of downing the milligrams or the dosage, and your doctor would be able to help you out with that, so that it's not just something that you click the light off. Mm-hmm. Potentially that could cause death, and we don't obviously want that to happen to anyone.
Yeah, that's weaning someone off of their medication or cutting down their medication. And sometimes even doctors will prescribe another medication to kind of help with the withdrawal from the medication they're weaning you off of. So that's where, doctors go to school for a really long time so they can figure all this out. So don't try to be a scientist. Yes. I mean, do try to be a scientist and go to school for it. It's awesome. But don't be your own scientist.
All right, so narcotics, what is their effect on the mind? So besides their medical use, narcotics or opiates produce a general sense of well-being by reducing tension, anxiety, and aggression. These effects are helpful in a therapeutic setting but contribute to the drug's abuse. Narcotic use comes with a variety of unwanted effects, including drowsiness, inability to concentrate, and apathy. What is their effect on the body? Narcotics are prescribed by doctors to treat pain, suppress cough, cure diarrhea, and put people to sleep. Effects depend heavily on the dose, how it's taken, and previous exposure to the drug.
Yeah, so a lot of what we saw when narcotics were being highly prescribed is that they were given to people who had oral surgery or some other surgeries, and a lot of where the pain was coming from was actually inflammation. So if they would have just been prescribed an anti-inflammatory like an ibuprofen or things like that, it would have actually helped reduce the pain a lot more. But this is all stuff that we've kind of learned through the opioid crisis. We didn't really know that much about it before. So we've learned a lot of hey, we could have actually been doing a little bit less and not over-prescribing, but that's a whole nother topic. But yeah, so it does treat pain. However, a lot of the times when it was being prescribed for pain, was for inflammation caused pain, which if we would have done anti-inflammatories wouldn't have been as bad.
And a lot of the times the pain is controlled by opiates by controlling the pain receptors, and then when the opiates stop, people's pain tolerances are worse because they are used to the opiates kind of numbing their pain, and so when they feel pain after they stop, it's worse. So.
You want me to keep going?
Yeah.
All right.
Yeah, I think Mr. Cody talked a little bit about fentanyl.
Yeah.
And he described with the penny and on the side there. And you can see how it's 100 times more potent than morphine, 50 times more potent than heroin as an analgesic. Morphine, again, is a fantastic drug that can be used to help with pain. But when it comes to other properties, it can cause severe damage to people as well, too, including death, which is, again, something that we don't want to have happen. And unfortunately, as Ms. Ashley described, it happens way too often. And unfortunately, we were prescribing a lot of medications 5, 10, 15 years ago that we didn't necessarily need to. And there were a lot of lives lost because of that. So it's an unfortunate situation.
Keep going, Leah, if you want.
All right, so heroin, this is underneath a narcotic. So heroin is a highly addictive drug, and it is rapidly acting opiate. Effect on the mind. Because it enters the brain so rapidly, heroin is particularly addictive, both psychologically and physically. Heroin users report feeling a surge of euphoria or rush, followed by a twilight state of sleep and wakefulness. The effect on the body, it definitely causes addiction with regular use of heroin use. Tolerance to the drug develops. Once this happens, the person must use more heroin to achieve the same intensity. So you're always chasing the dragon.
Yeah, and with this, it talks about how it gets to the brain rapidly, and it's a rapid acting substance that enters the brain quickly and then exits the brain relatively quickly. Like, it doesn't stay for a longer amount of time, where those medications that people get prescribed are a little bit more long acting, so they last, several hours. They can take it over like every 4 to 6 hours, where heroin is something that would need to be ingested much more frequently, in smaller amounts.
Those are just some pictures of different types of heroin. So brown powder heroin, heroin liquid packets, and white powder heroin. Do you want to take this one, Ashley?
You want me to talk about hydromorphone? All right, so hydromorphone belongs in a class of drugs called opiates, which includes morphine. It's an analgesic potency of 2 to 8 times greater than that of morphine. It has rapid onset, so it's injectable or it can be taken in pill form. So it reacts in the body much quicker than morphine. So morphine might be something that takes a little bit of time to get into the system. Hydromorphone is much quicker. When it's used as a drug of abuse and not under doctor's supervision, it is taken to produce a feeling of euphoria. So if you guys are kind of getting the theme of why people use opioids, it's because of this feeling of euphoria. It causes relaxation, sedation, reduces anxiety, mental clouding, and changes in mood, nervousness, and restlessness. And it calms centrally to reduce the pain. So it actually has a direct effect on the brain. It's not going to like the site of the pain, it goes directly to the brain. So it would be an all over body feeling, and it causes both psychological and physiological dependence, which is pretty common for the rest of the opiates that we've been talking about. Methadone. So methadone you may have heard as a treatment actually for opioid use disorder. So if someone was using opioids are abusing the opioids, they might have been prescribed methadone from a methadone clinic or something like that, and that's something that is highly regulated, but it is a man-made narcotic, so it still has the same or similar side effects if someone is withdrawing from it. So methadone is something that someone can be prescribed actually for years and years and years. So someone may be on methadone for the rest of their life. And it doesn't have as much of a physical effect on the body as some of the other opioids with how they break down parts of the body. It can cause things like sweating, itching, sleepiness. So it does, if it's not prescribed properly or not used properly, it can cause some of those same side effects that other opioids do. But the point of someone being prescribed methadone is that it is highly regulated and it is put in a very controlled environment so that the person isn't abusing it and they're not experiencing the withdrawal. That's the goal.
Yeah, and I would add as well too that in Macomb County we have several different methadone clinics to help people out. We've actually run some programs, strengthening families programs through those organizations. One of them being Biomed.
Let's say Biomed. There's several Biomeds.
Yep.
All right. Morphine, which is something that we've kind of talked about already periodically. It's a non-synthetic narcotic with a high potential for abuse and is derived from opium. And it's used for the treatment of pain. So this is something that's typically administered in the hospital through an IV, things like that. Once again, the euphoria, the relief of pain. Chronic use of morphine results in tolerance and physical and psychological dependence. It can cause a decrease in physical pain, decrease in hunger, and inhibition of cough reflex. So the person, if someone has like a chronic cough, this wouldn't be the first thing prescribed, but it might be used in situations to cut down on that reaction. Opium is a highly addictive non-synthetic narcotic and is extracted from the poppy plant, the Papaver somniferum. I'm not saying that is the correct way to say it. I actually, when I first went through this, I'm a giant Harry Potter nerd, and I was like, that just looks like a cell. I don't know what it would do, but.
Somniferum.
somniferum. See, it's a
Oh.
papaver somniferum sounds like I just made something happen somewhere and I don't know what it was.
Yes.
Sorry. Anyways, so this is where when we hear that heroin and other opiates come from the poppy plant, this is a specific example. The opium poppy is the key source for many narcotics, including morphine, codeine, and heroin. The opium high is very similar to a heroin high. So once again, that euphoric rush. So it doesn't last long, but there is this increased feeling of euphoria. And then it's followed by a relaxation. So you might see like a person feels extremely happy. They feel this euphoria and then they may pass out, sleepiness, things like that. Opium inhibits muscle movement in the bowels, leading to constipation. So this is something you hear a lot, even with people that are prescribed opiates, is that they have increased constipation. So then there's another medication that has to be prescribed to kind of combat that. So with the muscle tension, it causes that, and it can cause dry mouth and mucous membrane and drying mucous membrane in the nose, nosebleeds, not good. Opium use leads to physical and psychological dependence and can lead to overdose. So all of these have the potential to lead to an overdose, which is when things like naloxone or Narcan, I'm like, why can't I think of the name that everybody else knows? So when you use Narcan, that pushes the opiates out of the opioid receptors. There's plenty of free trainings that you guys can attend. Feel free to reach out to us. We'll direct you in the right direction.
And this actually, just to point out as well too, this would be a good spot to mention Families Against Narcotics.
Yes.
So they do a lot of trainings. We actually have gone through trainings with them, and we've had some collaborative efforts with Families Against Narcotics as well too. It's not only in Macomb County. It originated in Macomb County.
Mm-hmm.
Judge Linda Davis, now retired, but it is throughout the state of Michigan as well too. Those organizations, again, it's Families Against Narcotics, or FAN.
Yep, Families Against Narcotics, and they're still, so we're recording this during COVID-19 shutdown, stay home, stay safe order. They're still doing they're doing trainings over the computer, so you can still, and they'll actually send you the Narcan. And they also have plenty of other resources like peer recovery coaches and things like that. So if you guys want to be directed towards them, you can reach out to us too, or you can search them, Families Against Narcotics, great resource.
In the Narcan, naloxone would reverse what is happening to somebody that is in, an overdose, potentially overdose situation. And when we went through the training, basically what we were told, I shouldn't say basically, but what we know is that it only acts on those receptors in the brain, so it doesn't cause any other problems. So if the person was, wasn't opiate related, it's not going to cause damage to their brain or to their body if that was administered.
Oxycodone. So oxycodone was kind of one of the substances that was at the center of the opioid crisis. It's a semi-synthetic narcotic analgesic, and historically has been a popular drug of abuse among the narcotic abuse population. So like I said, back when we were seeing upticks in doctor shopping and prescription of narcotics, we were seeing oxycodone in the center of it. So it causes that feeling of euphoria, and then relaxation, high potency for abuse. So that, like I said, it's another narcotic. It's Schedule II because it can be prescribed, but it was highly abused when it first was being prescribed.
If you want, Miss Ashley, I could take over. And then you
Stimulants, go for it.
All right. You did a great job, by the way. So excellent explaining. You too, Miss Leah and Mr. Joe. All right. So stimulants speed up the body system. So essentially, some things that would be included in a stimulant would be things like methamphetamine and cocaine. Also bath salts, which we'll talk about a little bit later, and not necessarily as well known. But these stimulants have different side effects. As you see on the bottom, there is actually a Ritalin, which is a prescribed medication, like we referred to as with opiates. Sometimes Ritalin is very, different things would be like Adderall as well too, but it's very helpful for as ADHD medication. However, it does act as a stimulant on the brain, so it would have similar side effects. if somebody were to abuse it or if maybe their body did not react well to it. So the next one. So it says here, it produces a sense of exhilaration and enhances self-esteem, improve mental and physical performance, increase activity, reduces appetite, extends wakefulness for a prolonged period, and it causes people to feel high and euphoric. So a lot of the times people might stay up for days on end, which has a lot to do, a negative effects on the brain. It's not good, healthy for the brain, and a lot of the times this can lead to hallucinating, different moods and behaviors that would be very dangerous as well too. So stimulants also are referred to as uppers, and will reverse the effect of fatigue. So a lot of the times people might use stimulants, but they might use alcohol, and that would be a depressant. So essentially, they would be taking an upper and a downer and kind of pulling their body and their brain and their behavior and everything that their body wants to do apart. So typically when people would take a stimulant, they take it in a way that is quick hitting. So they might smoke it or they would snort it up their nose, which really is not good for their nasal cavity, can really lead to some issues there as well too. So kind of like what we were talking about with the mucous membrane.
Yeah, that's the whole why people, if you smoke it, you know, you have a lot of like vascular, like your lungs are very vascular, so it's going to get into your bloodstream a lot faster. If you're snorting it, your nose and your nasal cavity is very vascular, plus it's really close to your brain. And then injecting it obviously is the quickest, is going to very quickly get it into the bloodstream. And so yeah, people typically use stimulants in that way because it's quick, it hits hard, and you get the effects.
And Mr. Cody kind of talked a little bit about the ups and downs when using these, especially if, I should say, when you're abusing these, the ups and downs. Your body naturally has something what's called homeostasis, which is basically when we feel at ease for our daily routine. That's pretty much what we've been accustomed to. That's what we normally are doing. So that's our true homeostasis. If you're taking these, as Mr. Cody used the words that were written, to uppers and downers, your homeostasis is going up, and then it's going down, and then it's going up, and then it's going down, and it really can mess with your body. It can cause some severe withdrawal symptoms if everything's taken away, or if you cannot find those substances, or you cannot afford those substances. So you can understand to a better degree, I hope, why someone would choose to steal, whether it be from somebody that they love, that they care about, or from somebody that they don't even know, or from the store. And it's not because necessarily that they want to get high anymore. It's because their body is so used to going up and down that their pattern of being down is so bad that they'll basically do anything to get back up again. And again, that's that body, we have our natural homeostasis, and if we start to alter that, that causes some severe problems, or can cause some severe problems for us as an individual.
Yes, definitely. So as we move on to another stimulant, we see amphetamines, which I kind of talked about methamphetamine, so it's not to be confused with that. Amphetamines is something that would be prescribed for ADHD, and which is attention deficit hyperactivity disorder. And it sticks with the body a little bit longer than other stimulants would, like cocaine. But as you can see at the bottom, that chronic abuse of the substance has similar effects to what I was saying earlier, where people would have paranoia and begin picking at skin, be preoccupied with their own thoughts, and having hallucinations due to their lack of sleep and staying up late. Well, not sleeping at all. So typically, if somebody were to be abusing these substances, they would not be getting a lot of sleep, and then you would start to see some of these behaviors. Cocaine, another stimulant, creates a euphoria and has a very high addictive potential. A lot of the times people, when they are withdrawing off cocaine, will do things that are extremely violent or things that they just would not naturally do if they had not used cocaine in the first place. So some effects of cocaine include increased blood pressure and heart rate, dilated pupils, insomnia, and loss of appetite. So a lot of times people might not eat and they will stay up late, but also they might even have a heart attack. Typically when somebody overdoses on cocaine, it is because their heart rate is going extremely fast. So the widespread abuse of highly pure street cocaine has led to many severe adverse health consequences, such as irregular heartbeat, ischemic heart conditions. Did I say that right?
Ischemic.
All right. Sudden cardiac arrest, like I mentioned, convulsions, strokes, and even death.
And something else that we've been seeing in the last couple of years is an increase in deaths related to cocaine due to it being cut with opiates.
Yeah.
So it's being laced with fentanyl and things like that. So as you can see, they're both light powdery forms that if they're mixed together, you probably can't really tell which is which. So we have seen an increase in deaths related to cocaine due to actual opiate overdoses because of how it's been cut.
Yep.
And an ischemic attack would be a stroke. People can have many strokes, so they may not even realize that they had those. So again, ischemic is a lesser than a full stroke. It could be an ischemic attack.
I see. Also to add on to cocaine is crack cocaine, which essentially is a cut form of cocaine into a rock, and it's cooked, and then people would then ingest it by smoking it. It has a very short-lived effect, around 15 minutes, I believe. And so essentially what happens is people end up having to continue to use it periodically due to its short effect, and it can really become an expensive habit for a lot of people. So typically crack is the cheaper form. And also people, they just never know what that is cut with, and they're inhaling it, smoking it, just not necessarily good for them at all. So very addictive substance. Methamphetamine is a stimulant. It's also known as meth. Meth is a highly addictive drug and is very potent with the central nervous system. It is typically smoked or ingested. People can also snort it or ingest it orally. Both the rush and the high are believed to result from the release of very high levels of the neurotransmitter dopamine. So essentially, it is a chemical in the brain that makes people feel good in the areas of the brain that regulate feelings of pleasure. So long-term meth use results in many damaging effects, including addiction. But also, I don't know if anyone has ever seen mugshots of people who maybe use methamphetamine, but over like a course of a year, they will have lost a lot of teeth, have scabs on their face from picking at their skin, lost some hair, it even looks like, just really have not taken good care of themselves. It almost looks like their face deforms just from the use and the side effects from it. It's a very controlling substance and is devastating as well to communities. And also it's something that people, it's dangerous to make. And when it's made, it can kill people as well too, due to the fumes and explosions and things like that.
So smoking in it or injecting it gives you that rush, so it's going to be a lot shorter than oral ingestion or snorting, which is going to have like a long-lasting high. So that's going to be like a lot longer of a period of time that you're going to feel that.
I see. Different ways. So a depressant would be something that kind of is the opposite of a stimulant. It would be known as like a downer, like we mentioned from the slide, and it will induce sleep, may relieve anxiety, may help muscle spasms, and prevent seizures even. So there are some helpful uses for these things. Sometimes it might be used in a short-term setting, maybe for a high anxiety situation. If somebody were having an anxiety attack, they might use this medication. It might not be something that they use every day. might be something that they do use every day for different reasons. And also it could be used as something that they would use for sleep. However, all of these are prescribed by doctors, but we will see maybe in the next slide some that aren't.
Yeah, so barbiturates were what were like traditionally prescribed as depressants. They're not prescribed as often anymore. It's kind of transitioned over to benzodiazepines or benzos. And so you hear it a lot in music nowadays talking about Xanax and things like that. But like Xanax and Klonopin Xanax, Klonopin, and Ativan are pretty commonly prescribed benzos that have a high abuse potency pop probability, but it's typically going to be highly regulated by a doctor, and we'll get into all of it.
Okay, so thank you. Essentially, some depressants also can relax the muscles. So unwanted physical effects may be slurred speech, loss of motor coordination, weakness, headache, lightheadedness, blurred vision, dizziness, nausea, vomiting, low blood pressure, and slowed breathing. So essentially, it might even relax people's muscles to the point where their lungs aren't breathing to the extent that they should. They can't see maybe with their eye muscles, things like that, maybe even talking. And that's something that they can't control after that point, unfortunately. So that might be some side effects that they could experience. So it says individuals may abuse depressants to experience euphoria. Depressants are also used with other drugs to add to the other drug's high or to deal with their side effects. Users take higher doses than people taking the drugs under the doctor's supervision for therapeutic purposes. So we kind of talked about like dependence and things like that. So one thing that kind of grows on people is tolerance. And if they end up taking things or abusing things, they can grow a high tolerance to a substance, which would cause them to have to take more and more of that substance in order to feel the effect that they felt before. And so sometimes that is something that could happen with depressants if they are not taken how they're prescribed. Doctors, though, nowadays have done a lot to prescribe certain things, opiates and depressants, things that would be helpful to people. They have done a good job of prescribing them in a way that would be less harmful or lead to abuse. So next slide.
Oh, we might have to wait for a minute for Miss Ashley. We obviously are doing this live, even though we're recording it as well too. She had to step out for a moment. And with the depressants, again, for a lot of people, depressants can really help people out. Antidepressants can help people out. So as long as they're used the way that they're supposed to, under doctor supervision, psychiatrist, things of that nature, or people of that nature, they can be highly effective. So we'll move on to barbiturates.
So these are something that isn't as popular. They're classified as, they have different classifications, which would be ultra short, short, immediate, and long lasting. They cause a mild euphoria, maybe even lack of restraint or relief of anxiety and sleepiness. So it slows down the central nervous system and essentially causes sleepiness. So it's kind of something that could get people to calm down a little bit, which can, like Mr. Joe stated, can be very helpful.
Yeah, what we would also mention in regards to that as well too is if you are under the age of 18, we would want you to make sure that you are taking these medications in front of an adult, whether it be your mom, dad, guardian, aunt, uncle, but they should be the one that is in charge of your medication. Obviously, if you're at school, any medication that you bring to school, that would include any aspirin, anything like that. You need to make sure that you check it in at the office. Whatever the protocol is, your mom, dad, guardian might have to drop those off to the school, and then you might be called down to the office, and then you can take the medication. It just depends on what the school district, what the protocol is for the school district. But you don't want to take any of these medications out of their bottle and then carry them around in your pocket, because you can get in trouble for that. especially if it's a controlled substance, you can get into a lot of trouble, criminal trouble for those things. So we want to make sure that we keep them in the container that they were prescribed, and you've got that from, whether it be Walgreens, Walmart, CVS, whatever pharmaceutical pharmacy that you receive those from. You want to make sure you keep them in there, because even when you're traveling, if you're riding in a car, taking a train, a bus, plane, whatever it might be, we want to make sure it's still in that container. Otherwise, again, you can get in trouble for that.
Yeah, good call, Mr. Joe. Well, even though something is prescribed by a doctor, people typically get a pretty hefty penalty if they're selling their medications or even, not carrying them properly. So benzodiazepines we're talking about are a depressant that produces sedation and hypnosis, can relieve anxiety and muscle spasms and reduce seizures. So very helpful for some people. Benzodiazepines are associated with amnesia, hostility, irritability, and vivid or disturbed dreaming. So those are to be some unwanted side effects that may occur if somebody's body didn't react properly or they would be abusing it. Benzodiazepines slow down the central nervous system like barbiturates do, and can cause sleepiness and a relaxed mood. So can cause, it doesn't always cause it.
Yeah, and something to add as well too, in regards to prescription drugs, never give your prescription drug to someone else. If it's prescribed to you, you're the one that's supposed to be taking it as it is intended. So whether it's once a day, twice a day, with food, without food, again, don't give anything to someone else. If your friend has a headache, they need to go to the office, they need to talk to an adult about that, and then they can go from there in regards to that. Don't ever give out any medications to anybody, whether it's prescribed or not, especially if you're in a school setting. You can get into a lot of trouble for that.
Yep, definitely. So gamma hydroxybutyric acid is another name for the drug sodium oxybate, and it is typically misused for an euphoric and calming effect, and because some people also believe that they can build muscle and cause weight loss from it. So that'd be that one. Rohypnol is trade name for flunitrazepam, and that is a depressant that belongs to benzodiazepines as well too. So the next but classifications of drugs or substances would be hallucinogens. So they're typically found in plant and fungi and can also be synthetically produced. It is the oldest known group of drugs, and is used to alter human perception and mood. The most commonly abused hallucinogens among junior and senior high school students are mushrooms, LSD, and MDMA. They are typically taken orally, but they can be smoked. So,
And then synthetically basically would mean that you're taking chemical compounds from other chemicals, adding them together, and then you're creating something. So that would not be a fungi. That would be something that could be created in a laboratory, or it could be created in what they call a clandestine laboratory, which would be not something that is looked at by the Food and Drug Administration. That might be in somebody's garage. Obviously, that's not something that anybody would want to take and should not take.
Yes. Here are some examples. You see MDMA, ecstasy. They kind of have a drug culture stamp that they would put on their pills, typically, so you know who made the pill and things like that. You kind of see the LSD blotter sheet, which would be kind of something that somebody would maybe put on their tongue, and then that would cause them to hallucinate. And also you can see the LSD powder in capsules, which is a synthetically made substance. And you can also see the kind of culture that goes along with it. It's kind of very, lack of a better word, trippy. There's a lot of geometrical designs to the blotter sheet, and it is slightly enticing. There's you can see the culture behind it. So, all right. So physiological effects include elevated heart rate, increased blood pressure, dilated pupils, and can often include nausea and vomiting. Sensory effects include distortions. Perceptual distortions. You think I would know distortion playing guitar, but that vary with dose, setting, and mood. So basically, different things can happen based off of where they're at, how they're feeling, how much they take. So, and they lose associations with time and space. It might even appear to stand still. And they might see different shapes, patterns, but it also could lead them to seeing something that's very scary, something that they don't want to see. Could be traumatizing, could even lead to them doing something that would be life-changing or maybe even fatal. So another one would be MDMA and ecstasy. This is something that somebody might take in a social setting to get a stimulant effect, but it also creates kind of like a psychological or a psychedelic effect. So it gives people energy, but it also distorts their time and perception. Some people might take it. Some people who are young will take it because it will reduce their inhibitions, make them feel euphoric. So it mainly affects the brain that uses the chemical known as serotonin to communicate with each other. Serotonin helps to regulate mood, aggression, sexual activity, sleep, and sensitivity to pain. So as Mr. Joe stated earlier about homeostasis, serotonin is something that is very important when it comes to homeostasis, and MDMA is something that releases it all at once. It's kind of like a flood, and it can kind of lead to a future lack of serotonin. So somebody might feel very depressed after taking this because their serotonin is depleted.
And basically, when regards to serotonin, serotonin allows us, it's a calming effect, a natural calming effect on the body. So if you deplete that or eradicate serotonin, it can cause severe problems in the person can't calm down. So that obviously their homeostasis would be out of whack and cause agitation, nervousness, potentially hallucinations, a variety of different things that obviously we don't want to have happen to our body.
Yeah.
Yeah, so the big draw with this is typically going to be in like the electric, you see it a lot in the electric music culture because there's lots of bright lights, there's a lot of people, it's like you feel the music more so than like if you were to go see a band, so there's lots of like you feel it. And so this MDMA causes extreme sensitivity in the body, so like you seeing the colors is different, feeling the music is different, being around people is different. But another thing that we see a lot is dehydration that happens because there's dancing, there's like, it's a lot of people in a closed space. So dehydration is a big risk factor here, people passing out, things like that. And like Mr. Cody was saying, there's like this post-depression that tends to happen that lasts not just for like a day or two, like it can last for several weeks afterwards for those serotonin levels to be able to pick back up after.
And of course, we talked earlier about addiction. So if somebody was in that state that Mr. Cody and Miss Ashley were just talking about, if they were in that state, you can see how their frame of mind might be, oh, I know how I can fix that. I can go get some more ecstasy MDMA. That is what's going to solve my problem. Well, it might address the issue at that moment, but as Miss Ashley's saying, it's going to continue to be down, because as high as you go up, you're going to go down even farther. So if you're using the substance because you feel like you have to have it, again, it's going to cause you to go down even farther, and that's the continuum of addiction. That's what people spiral out of control, and that's where they start losing things, whether it be, their family doesn't want to talk to them anymore, they lose the privilege of being a free citizen because they're in jail, all those different things. We don't want those things to happen. That's why we're talking to you guys about this, so in preventative measures.
Right. So some of these effects of ecstasy and MDMA are alertness, increased motor activity, heart rate, and blood pressure. Some unwanted physical effects include muscle tension, tremors, involuntary teeth clenching, so gritting their teeth, muscle cramps, nausea, vomiting, faintness, chills, sweat, and blurred vision. So as you can see, the ecstasy pills at the bottom, similar, also known as MDMA. So a lot of the times these two are handmade. I mean, they're always all handmade, but it's not sure what is necessarily in these. You know, some of it could be actual MDMA and ecstasy. Some of it could be just cut. Some of it could be a harmful substance. Some of it could be deadly. Some of it could be much stronger potent opiate that they put in it to give it a stronger effect. So a lot of the times with these handmade things, it's hard to understand what exactly is inside of it. Ketamine, also something that you kind of see with the certain music cultures, because of the hallucinogenic effects that it produces, and it's also anesthetic. So it also makes people feel kind of like disconnected, which would be like an out-of-body experience. It's injectable, it's injectable. It's a short-acting anesthetic for use in humans and animals, and basically it makes people just feel detached completely from everything. Ketamine can induce a state of sedation, feeling calm and relaxed, immobility, relief from pain, and amnesia, so where people actually can't remember what happened. So it is abused typically for its ability to produce dissociative sensations and hallucinations.
Yeah, this is when someone's talking about a K-hole. Or so it was originally used as a horse sedative. That's how strong it is. Like you think of like horses and things like that, like it's a strong substance that, and so when someone goes into a K-hole, it's that dissociative state where it's like completely black and they're like disconnected from reality.
I see. So a Schedule 1 drug actually we're going to talk about that's hallucinogenic is LSD. It's very potent and it currently has no medical accepted use for treatment in the United States. During the first hour after ingestion, users may experience visual changes with extreme changes in mood. While hallucinating, the user may suffer impaired depth and time perception accompanied by distorted perception of the shape and size of the objects, movements, colors, sound, touch, and the user's own body image. So basically everything that they perceive is not actually real. So you can imagine how that might actually lead to some issues in people's life if they have to proceed with their life and what they're doing doesn't perceive real to them. The decisions they might make, the choices that they might, things that they might do to themselves even, viewing themselves, maybe if they saw themselves in a mirror and things like that. Just the absolute chaos that it could actually create. So another hallucinogen is peyote and mescaline, also Schedule 1. It is a spineless cactus. And they basically take the active ingredient out of there. It creates illusions, hallucinations, altered perception of space and time. So as you can see, like illusions, and also, like I said, altered body image. So all those things could actually create anxiety within the person, maybe even lead to severe consequences, as you can see.
And there is some recognition that peyote is sometimes a cultural thing. As much as it is considered a federally illegal substance, there are some cultures that use it as a religious experience. So this is obviously, we're not trying to say that it's necessarily against that, but like we do recognize that sometimes substances like this, like peyote, is used for a more spiritual experience. But obviously, once again, we are in the prevention world, avoiding use before a certain age especially. So this isn't something that we would want to introduce to our brains before, the age of 25 or things like that.
Yep. Psilocybin also comes from mushrooms, basically, and it also will create a hallucination where people cannot discern fantasy from reality. People could have panic reactions to it, and psychotic-like episodes may occur, typically in a higher dose. May also create nausea, vomiting, muscle weakness, and lack of coordination. So psilocybin, when it's injected, I believe the reaction in the body is actually a poisoning that people are experiencing. So it's not necessarily that's how it's affecting their body. Steroids, Schedule 3. So you might see like athletes that got in trouble for taking steroids, not necessarily a psychologically dependent substance. However, it is a hormone testosterone that can be abused. Also, steroids are used for medical purposes that are helpful. If somebody might have like I don't know, if they maybe have like arthritis and things like that, they might use steroids. Or cortisone, right? Isn't cortisone maybe?
Cortisone's for arthritis. These types of steroids are typically going to be used if someone has like a maladaptive growth disorder. So maybe they're like undergrown or things like that. So they need promotion of like those hormones that kind of encourage like puberty and things like that.
I see. So yeah, there are helpful medical uses for them, obviously if prescribed by doctors and things like that. However, people can get these and abuse them. So that's why we're talking about them. Typically, some unwanted side effects of steroids can be dramatic mood swings, hostility, impaired judgment, and increased level of aggression. You may have heard of roid rage before. And a wide range of adverse effects is associated with the use or abuse of anabolic steroids. These effects depend on several factors, including age, sex, the anabolic steroid used, amount used, and the duration of use. So we're going to talk about another Schedule 1 drug. Although it is legalized for adult use in Michigan, marijuana/cannabis. I believe the cannabis is the Latin term, right? It's the scientific name for the plant. Marijuana is kind of just like the name given to it. So it is a psychoactive.
Marijuana is the legal name.
Legal.
So cannabis would be the more scientific. Marijuana would be like legally, and obviously some states spell it with an H and some spell it with a J, and there's a whole thing about that.
I know. Okay. Thank you. I didn't mean to say I know.
Yeah,
Thank you for chiming in.
The H would be Latin, which technically the state of Michigan, we spell it as marijuana with an H. That would be Latin. Marijuana with a J would be more in the Spanish.
I got you.
There's a history lesson behind that, but that would be a whole nother video.
Yes.
Yeah, that's what I was referring to. I understand that. Things like that are unfortunate. Okay, so next we have marijuana is produced by the plant Cannabis sativa. It has 480 constituents. Why can't I say that word? Constituents. Wow, it's like those people I work with. Aren't those your constituents?
Yes.
All right, yeah, I got you. I knew that word, but tough one. All right, so THC, tetrahydrocannabinol, is delta-9 tetrahydrocannabinol is believed to be the main ingredient that produces a psychoactive effect. So you may hear of CBD. That would be a cannabinoid that would be inside of marijuana that would not necessarily produce a psychoactive effect. So some short-term physical effects may include sedation, bloodshot eyes, increased heart rate, coughing from lung irritation, increased appetite, increased blood pressure, and sometimes prolonged use actually might might cause a decrease in blood pressure. But as you can see, it affects the blood pressure, and typically that it comes from the THC use. So when you want to chime in?
I'll point something out too, Mr. Cody, is that when we talk about CBD oils and things of that nature, it's actually it's called a cannabidiol. So it's not a true cannabinoid. So the cannabidiol, that is something that doesn't have THC in it. So if the CBD oil that someone is selling, if it's true to its nature, it should not have any THC in it. I take that back to a degree. There's minuscule amounts of THC. It would not be enough for somebody to get high. So the oils that you might see that people are selling or they're touting for CBD oils, again, there's so little THC in there, the person is not going to get high from that. And the Food and Drug Administration has not said that these CBD oils are effective. And it's for a variety of different reasons, one of them being that we just don't have enough clinical studies as it stands right now to show that they are actually beneficial for, let's say, we talked about before, pain or arthritis. They could be, but we don't know that for a fact. So we can't tell you for a fact that those things are actually working for someone. That's not to say that it's not, because I don't want to get into that discussion. But there is a big difference there with the CBD oil. Again, there is a very minuscule amount of THC in there.
Definitely. So typically when marijuana is smoked, the active ingredient goes from the lungs to the bloodstream and then goes to the brain, where it reacts with cannabinoid receptors on nerve cells and influence the activity of those cells. So these receptors are found in the parts of the brain that influence pleasure, memory, thought, concentration, sensory time, perception, and coordinated movement. So it interacts with those receptors, meaning that it affects the pleasure of the human, the memory of the human, all those different things. Short-term effects of marijuana may include problems with memory and learning, distorted perception, difficulty in thinking and problem solving, and loss of coordination. So those would be unwanted side effects. Of THC, I should mention. As Mr. Joe alluded to, the CBD oil would not have those side effects. So the marijuana concentrate is are highly potent when it comes to the amount of THC inside of them. They'll typically be known as like honey oil or butter, and they can be smoked. They also can be cooked or vaped in an e-cigarette or a vaporizer. So typically these high concentrates is what will actually trigger the psychosis if somebody does have psychosis from marijuana, because they are ingesting it all at once and they don't expect it to react with their body in the way it does. So they might feel actually like they're dying, or that they might hallucinate, things of that nature. So the fatalities that we have seen from people taking marijuana have essentially occurred due to the concentrates. Vaping as well too is a addition that we kind of are starting to talk about more in the substance use disorder or misuse disorder community, because it's kind of newer. But one thing that we do know about it is a aerosol, not necessarily a vapor, but some people might know it as a vapor. And what it does is it is heated up by electronic device and it is inhaled. Typically these vapes contain nicotine, which is the active ingredient in tobacco that would cause people to feel high, or not high, addicted and crave it. So when somebody vapes, they're ingesting nicotine typically. They can also vape THC as well too, CBD as well too, but THC and nicotine are typically the ones that interact with the brain and would cause a dependency.
And we have a whole video on this.
Yeah, we have a whole video on vaping. A lot of to us, or some things that we've been talking about, is like the marketing of it, kind of how they appeal to other people, kind of similar to how tobacco used to. It's just kind of a newer way for people to ingest nicotine, and we're starting to see addictions grow from it. Not to say that it hasn't helped maybe some people, but we do see some people actually pick up nicotine based off of just trying the vape.
And I'll jump in as well too in regards to THC. As it stands now, people that have unfortunately had psychosis because of the levels of THC, it's not a direct effect that they actually passed because of the THC that's in their system. Because they go into, let's say, a psychotic event, it might cause them to think that they can do things that they might not be capable of doing. And so that indirectly, they might get hit by a car or a truck. They may feel like they can jump out of a building, and that might cause their death. So their death is because, let's say, they unfortunately jumped out of a building and they perished because when they hit the ground. So it's indirect. The direct effect is because they, jumped out of the building. Indirectly, though, it's because they ingested so much THC that they didn't know all the things that were going on. And unfortunately, we're seeing more and more people in our emergency rooms that are having these episodes. And, any hospital would be able to acknowledge that.
So an inhalant would be like a household chemical or product. They would actually take a vapor from that chemical. They might huff it through a rag or through some other type of tool. And upon huffing that chemical, they would cut off the oxygen flow to their brain and feel intoxicated. The intoxicated effects may include slurred speech, inability to coordinate movements, euphoria, and dizziness. They might feel drowsy for several hours and experience a lingering headache. A lot of the times they might experience like a dry mouth and some other heart or health problems. But typically when an inhalant is used, it has a very short effect. So people who would abuse inhalants typically will have to use them very often due to its short-lived effects. So that could cause a lot of damage to the body as well, and a lot of damage to the brain, as it is typically or constantly inhaling things and interacting with things that aren't good for it.
And I think we're nearing the end of our slides. I believe we have only 4 or 5 left, so we'll go into the designer drugs. So bath salts, Mr. Cody was talking about that before. Synthetic, again, that would be human-made. So synthetic stimulants, often referred to as bath salts, are from synthetic class of drugs. Synthetic are central nervous stimulants and are designed to mimic effects similar to those produced by cocaine, methamphetamine, and MDMA, ecstasy. Unfortunately, many deaths have been reported due to the abuse of bath salts. So when we're talking about bath salts, obviously we're not talking about something that is over the counter that somebody purchases at a store for an actual, for a bath.
Epsom salt.
Yes, we're not talking about that. So just the terminology that is used.
It kind of looks like if you've ever used Epsom salt, either to like soak your feet or to like soak in a bath, it kind of looks like that. So it's got a very similar appearance.
Very much similar appearance. So again, the design K2 Spice, again, that was popular a number of years ago. The state of Michigan actually acted quickly, thankfully, in regards to this. And K2 Spice is not supposed to be on shelves anymore. And basically, my understanding of it is it was similar to, if you could think of potpourri and the leaves of potpourri. And basically what would happen is people would create some chemicals together. And again, this is clandestine, so it's not, a licensed laboratory. They would create a concoction of these chemicals and then spray it onto, let's say, potpourri or some other flower matter. And then people would use that, whether it be smoking, snorting, any way of ingesting it, eating it, so on and so forth. And even on the packages, if you saw any of the packages, it says right on there, not for human consumption. That didn't stop some people, but fortunately, the state of Michigan acted quickly, and that is not supposed to be on any more shelves, whether it be at gas stations, convenience stores, head shops, anywhere else. And Mr. Cody went over this as well too with the synthetic opioids, relieving pain, and then drugs of concern, DXM. Again, this is can be found in music culture as well too. People talk about it, write it in songs, sing lyrics about it, things of that nature. Kratom is another one, obviously, that you can see there. There are some difficult side effects that can happen with that. And drug use prevention resources. There's a number of them listed on here. And I also would like to most definitely thank Miss Leah for putting this together. Mr. Cody did a little help as well too. I think Miss Ashley helped out as well. But Miss Leah was at the forefront of putting this together. So again, we appreciate all efforts from our prevention team. And I hope to see everyone soon. Again, as we always say with our videos, we hope to see you soon in the classroom. I don't know if any other of our prevention team, if you guys have anything to add other than, all right. Well,
All right.
thank
We'll see you.
you,
Bye.
everyone, and make sure everyone takes care of each other. Thanks.